for an unknown age male seizing at the Walgreens.
Let's roll. All right, head to unknown age male having a seizure at the Walgreens. Seizure calls, man. You know what? I'm gonna go out on a limb. I'm gonna say this is a seizure. That's gonna turn into a cardiac arrest. Not conscious, not breathing when we get there. Immediately, we begin to think, like, what's causing the seizure? Is it somebody with a history that may be intoxicated now and been off their medications? Is it a new sickness? We definitely want to keep our minds open, but we also want to focus on the immediate life threat at that time. What's up, my man?
Yo, Mayo, you say he has a seizure?
All right.
I got epilepsy.
What hospital you normally go to, man?
Tulane.
Tulane? All right. What city you in right now?
New Orleans.
You want to go to the hospital, my man?
Yeah, I definitely need to.
Okay. All right, my man.
Did you have a seizure, baby, or you felt like you were gonna have one?
I pretty much, I think I did.
We got you, bud. Look, other than seizures, any other medical problems, high blood pressure, diabetes, anything like that?
I'm having trouble breathing right here in the throat.
Okay. Are you able to tell when your seizures coming on? Like you smell a certain smell, get like a...
They've only ever happened. Ah!
What's wrong, bud?
What's the matter, baby?
Muscle spasms too? Yeah. You been eating and drinking like normal, bro?
No, I haven't been drinking.
No, like water
Like
and
water.
stuff.
Oh, no, I haven't.
Okay. Patient also, being a little bit lethargic, just kind of a little slower to respond. It can be due to the seizure. It can be due to dehydration. Dehydration can cause a seizure, so it could be both of them.
Can I see your arm, sir?
Where you live at?
I don't live anywhere.
Homeless?
You homeless, babe?
How you feeling? You got any headache right now? Dizziness, blurred vision?
Very much so right here. A pounding migraine right here.
Okay. When the last time you had your Keppra?
I think it was stolen.
It was stolen? How long ago, man?
A couple of days ago.
Couple of days ago? Well, that definitely ain't that smoke, man. That's why you having them seizures, bro. You ain't been having your Keppra, big dog. Unfortunately, with epilepsy, a lot of things can trigger you to start having seizures. Missing a few days or a week, or like I said, changing prescription, that can really throw that patient off into having more seizures more frequently. So now look, I'm gonna ask, man, how you ended up homeless, man? Like, what happened? Like you from New Orleans, you moved to New Orleans?
My aunt had passed away in bed.
And you just been out ever since, huh? How long that's been, man?
Couple of weeks.
This all like still pretty fresh and everything, huh?
Yeah. Oh yeah. I wanna turn it around.
Right?
You know what I mean?
And you got every power to turn it around, man. Don't let them seizures set you back. Seeing this patient that want to change his life, it's refreshing and it's a sense of hope. Even though somebody's going through their roughest time, they're not giving up. They're still pushing. They're still fighting. They still want to better themselves. And for him to have that mentality in this very difficult situation he's in, every ounce of encouragement, every ounce of support is the biggest things that'll help him keep pushing through it. It's rough right now, but it's gonna get better. As long as you keep fighting, it's gonna get better. All right? It's gonna be all good, man. I know things may have not been so good before, but it's gonna get better. As long as you keep trying, don't give up, it's gonna be good.
You've always tried.
That's all we can do is try, right? That's all we can do, man.
3225, he advised that the attacker has some lighter fluid all over the female.
Fluid all over her body.
Right. Probably like after they beat on or whatever, like sprayed with that.
Lighter fluid.
Right. So it's probably kind of bad. $32.25. There she comes.
She was telling me that he started beating her, threw lighter fluid on her about the lighter.
All right. So we get to the scene, and Daryl's walking out with the patient. Her skin is bothering her a lot from the lighter fluid being on her skin. And she's also been physically assaulted as well. It's like there's so much going on for this lady.
It's like buku fluid in my ear. Everything's hurting in my ears.
We want that out, baby girl.
He kicked me in my stomach.
That's messy. That's not okay. Who was this to you? Boyfriend? Yeah, okay.
Baby, next time I ask who that is, I want you to say ex-boyfriend.
Are you having any issues with your skin right now? You burn it? Where at? In your face?
Do you take any medications for anything?
I took Subutex.
What'd you take that for?
Because I'm pregnant and I just got out detox last week.
And for a guy to take his boot and kick her in the stomach, that's almost an insurance or a miscarriage. All right, man, we go to the hospital. All right.
Dude, I threw it all over. What? They threw lighter fluid all over me.
So, man, we can roll out, bro. That's your mama?
Look, this ain't your fault, all right?
So I'm a paramedic for New Orleans EMS. We're gonna run her over to university, all right, baby? I'm gonna take care of her. Definitely gonna take care of you, sweetheart. I don't want you to look down on yourself, anything like that. We're equals in the back of this truck, and I'm gonna hold you down, all right? So what happened today when he got upset?
I saw it in his eyes.
It's because this happened before. Sweetheart, look, I ride in the back of this ambulance for a lot of years. I done seen it get a lot worse, baby. And you're saying that it's been beating on you, and for him to put lighter fluid on you?
Go.
That's what I'm gonna ask you. What is it, baby?
Because he's so sweet. But he's not clicking.
Is he on drugs or anything like that?
Great. The way he can get great, I get attacked.
Treating this patient is personal for me. When I was in high school, my mom was counsel to battered women. In some places, she had to go pick them up and even bring them to the house. So I can empathize with these women. You know, I know what they're going through because I've seen it firsthand at a young age. Does it seem like it's not getting better, baby? You seem like a cool little mama, and I just don't want nothing to happen to you, baby.
I'm trying to kill me.
Baby.
He wants me fall.
I do not want to come there and work some type of trauma code, all right, love? Since this happened, at least you did this first step. All right, baby, let me take all this. Look, I got your slippers too, babe. All right, baby, we're gonna pull you out.
How we doing?
Sweet young lady, man. She just going through it, bro. She could do so much better than this cat, man.
Student 231, you have a 36-year-old male, unresponsive. It says he is breathing.
Thing, non-6-6, little overdose.
Probably so.
Everybody out trick-or-treating in the neighborhood, man. That's all right.
Trick-or-treating in the hood, too.
Heather's at home right now giving out candy.
The lower middle class probably come to your neighborhood think they're gonna get some better candy. But you know what, if you got that good house, you always have that double back. You double back 3-4 times to get the fresh Snickers.
Well, you gotta give it at least, you know, a few minutes because they may recognize.
Hey, what's going on? What we got?
She found a needle.
She found, all right, we're gonna start bagging them. Who is this to you, baby? That's your son? All right, we're gonna take care of him.
Yeah. I understand.
We're gonna wake him up, don't worry. Just give us a couple of minutes and we're gonna get him up. What's his name? Darren?
Just keep bagging him, man. We get a call for an unresponsive male in a bathroom. He's barely breathing, and I saw a syringe laying next to him, indicative that he had some sort of substance use.
Can you get your Narcan ready, baby?
The fire department's doing a great job helping ventilate him, make sure he's staying oxygenated while we started an IV and gave a drug called Narcan. And it basically blocks the effects of an opiate-based medication or drug. Every 5 seconds on that bag, please.
Rub his chest, man, from us, turn around. Darren.
Can you hear it, man?
Darren. Rub his chest, man. Darren. There you go. There you go. Hold that down.
Wake up, brother. Spit that out on your side.
Now keep. Sit up. Just chill out.
All right.
All right, we got you.
Darren, listen to me. Darren, open your eyes. You overdosed. You overdosed. You was almost dead, my friend. Right, what, right. We gotta take you to the hospital, okay? Yes.
Yeah, Darren, you gotta go, man.
Stop grabbing at us. We're paramedics. Come on, let's walk outside.
Just had a little.
You know what happened, Darren.
What did it?
Just let me see your arm. All right? Because in case you duck out again, baby. What happened? You went unconscious for whatever reason. Okay? Look, I got the heat on.
Any street drugs or alcohol tonight? Just some weed? What about the stuff that was in the needle hanging out your arm your mama found? And
What happened?
You tell me.
What happened? What?
Oh, whip your behind, yeah?
What happened? What, Ma?
You don't know.
What you mean what happened, Darren?
I don't know.
You need to stop. Your child saved your life, okay?
Stop.
Your child saved your life. That's all you gotta know.
What you mean he saved my
He
life?
come and tell me you up there sleep on the floor
On what floor?
in the bathroom, Darren.
When?
It's all right, babe. You gotta go. Look, we gonna get her. You upsetting your mama, girl. You upsetting your...
I'm okay,
We gonna go.
man. Let me out.
All right, no, we gonna go.
Why my mama crying?
Because you overdosed and almost died. How many times do I have to say it to make you believe it? Oh. Dude, that last call was crazy.
That wasn't feel
I ain't
good.
gonna lie, his mama made me want to cry a little bit.
You know what? The son and the mother was the victims in that.
I talked to him in the hospital. He said, he's like, this is a damn shame. I said, it ain't a shame. I said, it would have been a shame if you'd have died from this.
Right.
I said, because you do have a son. You got a nice family.
Right.
So he's like, yeah. So, well, then don't let it be a shame. Learn from this, move your life forward, and be a better person because of it. It affected me that, the kid found his dad like that. I mean, no kid should have to do that. Most children are out trick-or-treating and having a great Halloween, and this is his. Sometimes it's just not fair.
Number 3251, you're responding to PD. Requesting for a female that was assaulted, stated she was strangled.
We get called out by PD for a 42-year-old female that got strangled.
Do I hate to go on these type calls, but it
No.
seems like we're getting this more often than not.
Yeah.
Man. But hopefully this lady is upright and talking.
Yeah, hopefully so. Alpha 3251, you can share what's on scene.
Hey, how you doing? How do you feel? How is your breathing? Is it okay?
Now a little bit, but still hurt. Get me.
Do you want to go to the hospital, sweetheart?
I don't have no money for pay for that.
Baby, your health is more important than a payment. The trauma to your throat right now, you can go to sleep right now and it can start swelling up and close up and then you can stop breathing.
Because no amount of money is worth your health, right? And you have a little pain, a little tenderness to your neck, you need to go get that checked out.
Maybe I go tell my uncle I go to the hospital.
Go ahead. A lot of people say that they don't want to go because of the financial obligations, but a lot of times it's just embarrassment. So you just have to let them know, like, hey, no one is here to judge. We're just concerned about your well-being. I'm sorry that happened to you. There you go. You're a little short thing.
Come on, man. I got you, baby.
We can see the bruising, but the thing that's scary is what we can't see, which is really concerning. So now we need to just do a hands-on assessment.
Come on there. There you go.
So look, sweetheart, I'm looking at your neck. You do have some bruising around your neck.
Yeah, he pushed my neck too much.
So did he choke you like with both hands?
Yeah, both hands, he do.
All right, I see you got some discoloration to your face. Did he hit you?
Yes, I hurt my right here.
And he punched you in the face?
Yes.
I gotta put this on you. I'm gonna put this mask on you, right, love? Does your neck feel like it's swelling up? Does it hurt when we put you on the back of the neck?
I feel hurt right here, on the neck.
Right here?
Yeah, right here.
All right. What about your airway? Is it easy for you to breathe?
No, I cannot breathe too.
Open your mouth.
Open your mouth.
And go, ah.
When I used my light to examine her airway, I noticed there's not really swelling, no redness in there, so that's a good sign.
Has he ever done this to you before, baby?
He did me before. Same thing like this.
Same thing like that? And this is a grown man.
I cannot stay with a guy crazy like that.
No, not at all.
No, not at all.
But you're doing the right thing by going to the hospital, baby.
We're gonna bring in the oxygen.
All right, we're gonna bring you to the hospital, all right?
Okay.
All right.
You good, T?
Yeah, I'm good, man. Look, my name is Titus. I'm gonna talk to you on the way to the hospital, okay?
Are you gonna be all right? Honestly.
I am in the car. But
No, I'm talking about after all that. After we fix the bruises, mentally, are you gonna be all right?
he said he love me. He give me money and he bring a food for me.
Right.
But he do that to me. I don't want that.
Let me give you a little story. My mom used to work for battered women back in the day, so when she raised me, I do have a certain amount of empathy for this because I've seen a lot of women that was destroyed through men physically. Do you want me to explain to the doctor and the nurse what's going on to see if we could give you some type of help?
Yeah.
There's always another option. You don't have to stay in an abusive relationship. So we're gonna get her lined up with all this information and give her options.
Look, let me tell you like this, sweetheart. I love my wife. I love her so much that I would never even think of putting my hands on her. That's what love is about.
You're the one a good guy.
Right, so if you love somebody, that wouldn't even cross your mind no matter what you're doing. I done seen cats do that and just abuse women, and that's just crazy. So for a man to say he loves you and put his hands on you, he's a sucker.
Be safe, be strong. Let's do this.
Get that stretcher in here.
You're gonna bleed to death.
They're not dead.
I can work with that.